Good afternoon, everybody. Thank you for joining us. My name is Sandro Galea, and I have the privilege of serving as Dean of the Boston University School of Public Health. On behalf of our school, welcome. Good afternoon, good evening, wherever you are in the world. This event is the latest in our series of public health conversations. At these events, we welcome speakers who guide our discussions about the issues that matter most for health. Our aim is to inform a conversation that supports a healthier world. These events are the work of many, and I would like to take a moment to acknowledge all who helped make today possible. In particular, thank you to Meredith Brown and Alicia Noel for coordinating our events, and thank you to you, our audience, for being a part of them. During the COVID-19 pandemic, the world faced a new normal. Now, with the emergence of vaccines, we are in a position collectively to look to the next normal. What the next normal will be depends on how we apply the lessons of the COVID moment to shaping a healthier world. Our next normal series aspires to elevate key learnings of the past year and a half to help us create a future that is radically healthier than our past. Thank you for joining that conversation. During the pandemic, we saw a worsening of health inequities across the world. This includes gaps in food access. Our capacity to access nutritious food is core to our ability to live healthy lives. When factors like food deserts, economic scarcity, and unhealthy norms undermine this access, our society gets sicker. For this reason, sustaining equitable food access should be at the heart of shaping the new normal. We are pleased to be joined today by this distinguished panel to lead our discussion of food and health. We're very fortunate that here to moderate this discussion is Julia Belluz. Julia is Vox's senior health correspondent focused on medicine, science, and public health. She has covered topics as varied as the anti-vaccine movement, America's maternal mortality problem, how dark chocolate became a health food, and what makes America's sickest counties so unhealthy. Before joining Vox, Julia was a Knight Fellow in journalism at MIT, and her writing appeared in a range of international publications. She has an MSc from London School of Economics and is a recipient of numerous journalism awards. I have over the years had the great privilege of talking to Julia about many of her stories, and I've really enjoyed all those conversations and learned from her. I'm really delighted to have Julia with us, and I turn the event over to her. Julia, over to you.
Thank you so much, Dr. Galea, and it's such an honor to be here and wonderful to join all of you tonight. I'm calling from Vienna, Austria, so it's very late here. It would be much more fun if we were all in a room together, but I think this is pandemic life in 2021. So I'm going to get right into introducing this distinguished panel, and they're calling in from 3 countries and 4 time zones, I think we just counted. So first, we're going to hear from Dr. Usha Ramakrishnan. She's the chair and distinguished Richard and Hubert Professor in Global Health at the Rollins School of Public Health at Emory University in Atlanta, Georgia. She's also a graduate faculty member of the doctoral programs in Nutrition and Health Sciences and Global Health and Development at Emory's Laney Graduate School. She has authored over 170 research articles in peer-reviewed professional journals, 19 book chapters, and edited 4 books, monographs, and proceedings, an expert in global maternal and child nutrition and health. She's joining us from Atlanta, Georgia tonight. Next, we're going to turn to Yilai Moy, a Bloomberg Assistant Professor of American Health in the Department of International Health at Johns Hopkins. Her participatory action research focuses on strengthening policy to create equitable, sustainable, and healthy communities. And she applies an urban planning lens to obesity prevention and healthy eating by critically examining relationships between food and other systems of the built environment like land use, transportation, and housing. She's calling in from Washington, D.C. Third, we're going to hear from Dr. Tallulah Oni. She's a clinical senior research associate at the University of Cambridge and a public health physician scientist and urban epidemiologist. Her research looks at how urban systems such as housing or food can be harnessed for health and how integrated health systems respond to changing patterns of disease and multimorbidity in the context of urbanization. She's calling in from Cape Town, South Africa. And last but not least, we're going to hear from Dr. Mei Wang. She's a professor in the Department of Community Health Sciences at UCLA's Fielding School of Public Health. She's conducted research related to child obesity and bone health with a focus on addressing disparities. And she's joining us from LA. So to begin with, I'm going to turn it over to Dr. Ramakrishnan. Please, jump in. I think you might have to unmute.
Despite a year of Zoom, I forgot to unmute. Thank you very much, Julia and Dean Galeo, for this kind invitation. I'm delighted to be part of this panel. And I'm going to kick it off with a few thoughts on where we are. Can you all see my screen? Yeah. Okay, I need to move my screen to where I can see it. Really, to give you an idea of where we are. We talk about being in 2021 already, but a global perspective on food and health in the 21st century. Give you a quick overview of what is known about the global burden of malnutrition, the nature of it. When we think of malnutrition, we tend to think of only hunger and lack of nutrition, but it's quite complex. The role of the Sustainable Development Goals that were developed pre-pandemic, but are still very pertinent with everything that's happening right now. Where are we? Are we on track? And what needs to be done? And a few comments on what is healthy eating. As a nutritionist, I often remind people we don't eat nutrients. We eat food, and I'm delighted to go before this wonderful panel and the work that Ely and Tallulah and others are doing, really looking at that intersection of food systems, public health, policy, and ensuring adequate health and nutrition for all. But as someone who's worked in maternal and child health, of course, I'm particularly concerned about the needs of vulnerable groups. So one thing which is important is that malnutrition is complex for more than a century. In the 20th century, considerable and rightful attention to undernutrition, the consequences of early childhood malnutrition, micronutrients. Considerable strides have been made. But at the same time, with the progress in increased food production, the role of the food industry, many parts of the world, communities have undergone the nutrition transition. And we have seen a dramatic rise in non-communicable diseases like diabetes, cardiovascular disease, cancer, many of which have roots in what we eat, and of course overweight and obesity is one important marker. And I point this out because in many parts of the world, there remains sort of what we call the unfinished agenda of undernutrition, while at the same time we have the emergence of these conditions that are related to not eating a healthy diet. And in this context, about 6 years ago, in 2015, time flies, the entire community, the world came together at a historic UN summit to adopt the Sustainable Development Goals. So I'm sure many of you think climate change is something we're talking about recently, but it's definitely been in the minds of leaders at the global level, that we need to, when we talk about development, growth, etc., one needs to address a variety of factors. And they came up with these 17 goals that are not just for a particular country or a region, but for the entire planet. One might call them planetary goals, but they really, the key in this was to address the inequities that are there globally, ending all forms of poverty. You see, the first goal is no poverty. And obviously, many of these goals are directly and indirectly related to food and health. But the one I'm going to really focus on is the second goal. So right behind poverty was this laudable goal of zero hunger. And they had two specific targets. And the purpose of the Sustainable Development Goals was to build on the success of the Millennium Development Goals. Millennium has come and gone. We're almost quarter through the century. But to really focus on the importance of having universal access to safe and nutritious foods, and then also focusing on specific forms of malnutrition. And there were and continue to have global targets. So the SDGs, as we know them, had targets to meet by 2030. And the global targets, which were developed with the help of WHO, actually have 2025, which is barely 4 years away. And they identified some key indicators of nutrition that are particular to young children and women of reproductive age. And so I'll talk a little bit about these, but these are really very critical life stages which have both short and long-term consequences. And quite frankly, a lot of work that I have been privileged to participate intergenerational effects. If a child is born low birth weight, for example, that sets up what happens to, if it's a girl in the next, her pregnancy later, etc. And so where are we on the targets? The good news is we've been able to collect fairly good data on some of these indicators of child malnutrition over the last decade or so. So at least we know whether we're making progress or not. And our target was, to bring it down. We can't eliminate it, but to bring down the number of children experiencing linear growth retardation. This is stunting, is children who don't grow to their full potential in terms of length. And that is 99 million. And the most recent data I found from UNICEF is we're about at 155. But what's worth noting is that the disparities, we have parts where it's there's hardly any stunting, and some parts of the world where, more than 1 in 2 children are stunted. And then we have wasting, and most importantly, overweight was also recognized as an important indicator of malnutrition. We want children to be in optimal health, and those rates are not as high as some of the others, but they are important. Less reliable data are available for hunger and food insecurity. There have been different measures, but I still wanted to point out that this is a much larger problem. This relates to people who feel they do not know where their next meal is coming from. And certainly the pandemic has clearly affected this indicator, and you'll hear more about it. But the purpose of showing you this graph is no region is spared. Even the Americas and Europe, nearly 10%. And I think if we update these numbers now in 2021, they may have even doubled. We're just not able to even count, measure it accurately. These are all pre-pandemic numbers. But there are significant disparities, and Sub-Saharan Africa has some of the largest numbers of populations at risk of both severe food insecurity and moderate food insecurity. So this, when we talk about zero hunger, this is not zero hunger. And unfortunately, these numbers, I don't think come down. If anything, the pandemic with all the disruptions has probably made it worse. We've made progress with reductions in some of these indicators of stunting, wasting, which is children who are too thin for their height, as well as overweight, but we're not there yet. If we were on target as per the SDG, we should be down here. So there's work to do. There's a lot of success stories, but there is also a lot of challenges. And once again, the pandemic has made these challenges even more insurmountable. I would like to bring to your attention a particular indicator that often gets forgotten is the prevalence of low birth weight. The reason this is important, this is the proportion of children who are born below 2.5 kilograms, which is an indicator of adequate growth in utero, is still high. There are parts of the world where we've made progress, but nearly half of all the low birth weight babies in the world are born in South Asia. And why is this important? This is a composite indicator of maternal undernutrition and the nutritional status of the next generation. These children are at the highest risk of suffering from consequences like neonatal mortality, as well as if they are lucky enough to survive, depending on where they're born, they suffer long-term consequences in terms of their total growth and potential. At the same time, we're dealing with obesity. So I'm switching gears. I said my focus is maternal child nutrition, but there is the burden of obesity is across all ages. And this is just showing you the prevalence of obesity in adult males and females that has gone up in all regions. It's not as high in some parts of the less, low middle income countries, but right here in the Americas, in Latin America, 1 in 3 adult male or female is overweight or obese. And this is actually not just overweight, this is obese. This is more than 30 kilograms of, the body mass index. And this puts these people, there's enough research to show that these people are at increased risk of several non-communicable diseases. And many of these can be modified by lifestyle choices and behaviors. So that gets me to, what should we be telling people? What's a healthy diet? And there's been a lot of work, and there's clear recognition that healthy diets are useful to both protect against malnutrition, whether it's undernutrition or overnutrition. And I'm sure you've heard about the Mediterranean diet. We have all these different ones. But one of the things in recent times that's been recognized is many of these guidelines, when they were originally developed, did not take into account the challenges of climate change, environmental sustainability. And there's been a call, as with the SDGs and the challenges of that we are facing in the century, they need to be taken into account. And so we now recognize that we have to advocate for sustainable diets that not only address, optimizing health and food and nutrition, but also have a low environmental impact, because we want to be on this planet for a longer time and not destroy it in a short period. And so as we think about, nutrition and health, we have to think about environment, sociocultural and economic. And most recently, a large group of experts from across 16 countries developed these Eat Lancet Healthy reference diet. And this basically is a reference to, what would be an optimal diet that can sustain health while protecting our planet? How can we feed the 10 billion people in an environmentally sustainable way? And one thing that's important to recognize, they really looked at adults and young children, but did not focus on, infants and young children who are a very vulnerable group. And I'll come back to that in a moment. I'm not going to read this, but they came up with certain recommendations. And a key part of this was, to reduce the intake of animal source foods, that we really don't need the amount that we're consuming, even though it's highly desirable. Restrict the intake of highly processed foods. You can see added sugars right down there. There's nothing wrong in having dessert once in a while, but you don't want to be constantly consuming a lot of added sugars and high fat foods. And this is, is aspirational, and there still are many questions. There's some studies that have shown, that following this diet is beneficial, but the practical challenges remain. How can we meet this with what people are currently consuming? What modifications are needed? And we really don't know very little about, vulnerable groups like breastfeeding women or pregnant women. And of course, when we talk about poverty as the first SDG, what's it going to cost? How can we help people meet the cost of, to have a healthy diet, but make it affordable? And this was an analysis that was done, and it's data from, using food price data 10 years ago. And we all know, even at an individual level, that the cost of food has gone up dramatically. And so this is old data, 10 years old, and they estimated that if someone followed what the Eat Lancet said, it would cost about $2, $2.50 in low-income countries, not so different in high-income countries. But the challenge in most of the world, where there is a lot of poverty, where there are a lot of inequities, this is still a substantial amount. And how does one balance? We do have some other approaches. Should we be fortifying foods? Should we be targeting certain subpopulations? So there's still a lot of work to be done. And I'm going to end with this final slide. This is, I told you the Eat Lancet doesn't talk about what to do with young children, but young children are a very important group. And this is data showing that globally, 1 in 5 children from poorest households and rural areas who's under age 2 does not get, the minimum food group. So again, as we're thinking about access to quality diets, the supply of fruits and vegetables, competing interests with processed foods, I'm going to hand off to my next speaker, who's going to be talking about food systems. Thank you.
Thank you so much, Dr. Ramakrishnan. And I'd like to pass it to Dr. Moy.
Thank you. Can you see my slide okay?
Yep.
All right. Thanks, Julia. And thanks, Dean Galea, and also to Meredith and Alicia for the invitation and opportunity to participate in this conversation. I'm really delighted to be here and joined by good company all over the world. Now I'd like to build on Usha's remarks, within this global context of food and nutrition goals, and share some of my perspectives on what food systems and food security challenges have been revealed here in the United States over the course of the pandemic. And the key challenges and opportunities that I'll highlight come from my food systems planning lens, where I work at the nexus of public health, food systems, and local government policy. First, just to be sure that everyone's on the same page, when I talk about food systems, I'm referring to all the interconnected infrastructure, policies, and people that enable food to travel from farms to our plates. So this includes activities from food production, food consumption, aggregation, food processing, transporting food to retailers, and the management of food-related waste. And in the context of talking about key challenges and opportunities in the next normal, I think it's critical to start with the people in our food systems who make all of this happen and continue to feed our families and our communities. So first and foremost, the pandemic redefined essential workers, and that includes people in every part of the food system, including farm workers, to grocery store workers, those working in food processing facilities, emergency food system staff and volunteers, and more. And it's important to note that while restaurants, schools, and other sectors shut down or moved to a remote working environment, farmers and farm workers never stopped working. And even worse, food system workers, especially in the agriculture and food processing sectors, received minimal protections, especially earlier on in the pandemic, including having to work in environments that were not set up for physical distancing, having to navigate crowded transportation conditions, and receiving little to no access to vaccinations. And as a result of food system workers under protection, we've observed severe food system disruptions that have contributed to both food shortages and wasted food. For example, in the meat and dairy industry, when thousands of workers contracted COVID-19, meatpacking plants were forced to shut down, which then affected farmers who had to euthanize their herds as a result of a backlog of animals. In addition, with almost the entire restaurant and food service sector closed for a good part of 2020, entire supply chains found themselves without a market. And again, farmers were then forced to literally pour millions of pounds of milk down drains, throw out seafood, and till back into the ground millions of pounds of onions, beans, cabbage, and other fresh produce. Meanwhile, on the consumer end, disparities in food security grew even wider in 2020, meaning individuals were worried food would run out before getting food to buy more, or that food just didn't last and they didn't have enough money to get more food. So food continues to remain out of reach, especially for lower income households, households with children headed by one caregiver, and communities of color that have been hit the hardest by the pandemic. In fact, a study published by the Food Research and Action Center reported that the Black-white disparity in food insecurity increased by about 3.5 percentage points, and the Latinx white disparity increased by about 2.5 percentage points from 2019 to 2020. And unfortunately, the physical and mental health consequences of food insecurity are likely to be felt by children and adults long after we recover from this pandemic. So given these challenges in our food systems, I would argue that we must restructure our structural systems. And by structural systems, I'm referring to the cultural norms, policies, institutions, and practices that define the distribution or maldistribution of neighborhood resources, including food, that are necessary for a healthy and thriving life. I think if we fail to pay attention to structural systems shaping our food environments and health, we really run the risk of finding ourselves in the same circumstances, or perhaps even worse in the future. So I think a good starting place is to gain a fuller understanding of existing structural systems and how we got here in the first place. I'm sure many in the audience have heard of redlining, but I'm bringing this up to demonstrate the intentionality with which structural systems were set up and the intentionality that will be required to therefore change them. So for those less familiar, redlining is an institutionalized practice of denying services and resources to a neighborhood based on race and ethnicity of residents in said neighborhood. On the left of your screen is a redlining map of Baltimore City from 1937. And this shows how the Homeowners Loan Corporation instituted redlining and intentionally denied investment in neighborhoods deemed high risk. So marked in red and yellow were neighborhoods that were deemed high risk because they were predominantly made up of African Americans as well as immigrants from Asia and Southern Europe. So in this case, you see neighborhoods in West and East Baltimore marked in red and yellow, and the best neighborhoods to the north marked in green. So red meaning hazardous, yellow neighborhoods indicating definitely declining. Now, although racial discrimination in housing was banned over 50 years ago in the country, the impacts of these policies are still felt today. On the right is a map of the unemployment rate in the city of Baltimore in 2019. So the darker shades indicate worse outcomes in the situation, meaning higher unemployment rates. And you'll notice the darker shades or higher unemployment rates are found in West and East Baltimore, similarly overlapping what were previously marked as red and yellow neighborhoods. Lighter shades or lower rates of unemployment up to the north overlap similarly with previously marked green line neighborhoods. This map here is of children in poverty in 2019 in the city of Baltimore. And again, we see these darker shades in the west and east sides of Baltimore and lighter shades to the north here. This is a map of a COVID-19 local risk index, which reflects social and economic factors and health outcomes relative to other neighborhoods. And this is of the COVID risk index in 2021. And once again, we see the darker shades in West and East Baltimore, lighter shades to the north. And finally, here is a map of healthy food priority areas in the city of Baltimore in the year 2018. And the red are neighborhoods where there are healthy food priority areas, meaning there's low access or low availability of healthy foods. Once again, we see the reds overlapping with red and yellow lined neighborhoods. And to the north, which were previously marked green lined, we don't see any of these healthy food priority areas. So some scholars refer to these overlapping insults to health as syndemic conditions within which Black and Brown Americans experience inequitable environments, including food environments. So to foster a healthy food environment and address disparities in food security, we can no longer ignore these upstream structural systems that shape interconnected housing, economic, and food opportunities. Now, one way the city of Baltimore is working toward correcting the impacts of past harmful policies, such as redlining, is by developing resident-driven solutions. The Baltimore Food Policy and Planning Department is working with a group of resident food equity advisors who are residents from each of the 13 city council districts to examine challenges in the community food system and guide local government decision-making. Residents go through a multi-stage capacity building and information sharing process over the course of several months. And this collaborative governance mechanism is meant to draw on advisors' lived experience and expertise to focus on whole system solutions to food-related challenges. In this last year, the advisors focused on food challenges experienced by residents in public housing communities. And the advisors generated a set of recommendations from their lived experiences and intimate knowledge of Baltimore's food system. One set of recommendations primarily focused on challenges around transportation, specifically transportation barriers to food. So advisors developed a range of recommendations, including providing monthly rideshare credits, locating bus stops so that they're closer to food stores, creating more direct transportation routes to healthy food stores, and more. Another example I'd like to highlight of restructuring structural systems comes from Toronto, where a Black food sovereignty plan was just approved by council earlier this month. The plan is a multi-million-dollar commitment to combat the root causes of food insecurity and build increased resilience and well-being for Black communities. It's truly one-of-a-kind plan, centers on agency in the food system. And I've included this quote here from Anand Laloli, who's a food justice activist in Toronto, who describes food sovereignty as the right for people to have healthy and culturally appropriate food produced through ecological and sustainable methods, and their right to define their own food and agricultural systems. So lastly, I think the challenges in the food system highlighted by the pandemic are complex and dynamic. Therefore, I would argue that the solutions to advance structural systems change will be most successful when they engage multiple sectors, including housing, transportation, economic development, and environmental sustainability. And most importantly, solutions ought to be driven by community members who have been historically excluded, marginalized, and made to be invisible, especially food system workers and families and communities experiencing the highest rates of food insecurity. So with that, I'll end and turn it back over to you, Julia.
Thank you so much. That was really fantastic. Now we have Dr. Oni up from South Africa.
Great, thank you. What incredible acts to follow. Thank you for the invitation. And I will be focusing on food and food and health in tomorrow's cities today. Sort of titled it. So I work at the University of Cambridge and I lead a global diet and ethics activity research group there. And the majority of my work is in the African region, with some additional work in the Caribbean and Latin America as well. So this is the first thing I wanted to take a step back to show you, because when we're talking about food systems, and I think one of the speakers alluded to it, we are talking about a global system. And what I wanted to emphasize here was really how how the different pressures on cities play out in different ways globally. So this looks at the number of people moving into cities per hour, so the hourly growth in different cities. We have quite a few cities, countries represented on this panel today. I'm normally in London, you see about 10 people per hour. Atlanta, we have 11 people per hour. If we compare that to Lagos, it has 56 people per hour. Karachi, 51, Delhi, 75. We start to get a sense of really just how the varying pressures, right? And how much nuance there is globally when we talk about the supply and demand of food. So I'd like you to bear that in the back of your mind as we're talking about food in the context of urban health. My first couple of slides will be a bit conceptual and just to take us a step back and situate us really within the context of the city. So on the right-hand side, we're normally thinking about, the health outcomes, so the disease states that we're seeking to avoid with healthy eating and healthy, nutritious food security. As you move from right to left, and the previous speakers alluded to this, really the importance of looking upstream. And I focus this on the city context, and the framework shows a couple of things, right? So if we start with healthy eating and food security, I wanted to point out first that even in the context of behavior and exposure, we ought to remember that is very interconnected with our physical activity opportunities, our connectedness and sense of community, our healthcare access, etc. So those exposures are already connected, as are indeed the health outcomes. So then if we move to the left, we can see, well, thinking about healthy eating, yes, we need access to healthy food environments. We also need responsive healthcare systems that can act as early warning systems and identify food insecurity early to prevent. We also need inclusive and supportive transport systems, because if you're not connected within the city, accessing food is just simply not the rational choice in terms of accessing healthy food if you have to spend a long time traveling to get there. And going even further upstream, we see really the different land use states in the context of cities and really how interconnected those four different environments are. So even though there's the food environment there, it was just a reminder that what we're also talking about is how that relates to land use in terms of zoning in the built environment, in terms of natural environment, which I'll speak to shortly, and critically in terms of social environment. I like the first speaker who mentions we don't. I'm going to massacre your statement, but we don't consume nutrients. We consume food. Food is a very social behavior for a lot of people. So that social environment is so critical and is often forgotten in the kind of evangelism, if you like, of public health. So that's the first point. If we add another layer of complexity and look at the food ecosystem in the context of a planetary syndemic, so the work that we do intersects health in terms of food and physical activity with urbanization and climate change. And I mentioned this because if you go back to the first slide, and the cities that are or the parts of the world where the cities are growing most rapidly, where urbanization is happening most rapidly, are also often the cities that face ecological vulnerability. So this image was great ecological vulnerability. We all face that. So this is showing that over and above all of those exposures and land use, land system changes, there is that background context. So if we think about the food environment, we know that the background context of air pollution impacts food productivity. We know that waste and water pollution impacts your ability to access healthy drinking water, which impacts your consumption of sugar-sweetened beverages. We know that climate change, and I'll show in the next slide, and ecological disruption has huge significant implications for access to healthy foods. And similarly with biodiversity loss, some of the shocks related to these extreme weather events and migration and detaching people from their sources of healthy eating. So it's really important, just to add that extra layer of complexity, that if we are going to be thinking about addressing the next normal, which I'll come to in a couple of slides, we really have to ensure that we are factoring this context. So I feel like I've spoken too quickly. There are 4 things I want to reflect on, because this is about the next normal in food and health. And there are 4 aspects that I want to focus on. The first is that the next normal must be future-proof. So picking up on the last slide, this is just a schematic to illustrate the kinds of risks and hazards that cities face that have significant implications for health. So in this context, for example, the nature of urbanization in the fastest growing cities is one of sprawl, of significant informality, of circular migration, and that kind of dynamic aspect of living that interacts, and those generate particular hazards that impact on food and health, as highlighted here. The climate change aspects in terms of changing weather patterns generate these climatic hazards that also impact on food and health. One easy example come up with in one of the countries that we work in Kenya a couple of years ago, actually just late 2019, had a huge locust infestation that wiped out huge swathes of crop, and that was due to the extremes of weather, of having drought and then flood, resulted in this biblical locust infestation that really pushed many households over the edge in terms of food insecurity. So we really have to think about how these climatic hazards interact with urbanization hazards to impact health. And really that intersection between them, bearing in mind that some of the socio-environmental vulnerability that the previous speakers have highlighted is a critical component of the next normal. What did I say here? Yes, I think we've covered that. The second aspect of the next normal, I think it needs integrated governance. So bearing in mind what I just said in the previous slide of the different components, what we still find is in taking action, this siloed approach in terms of what we measure, be that measuring food environments, be that measuring health outcomes. And so when I think about integrated governance, I think about 3 A's. I think about actors, agency, and accountability. So when we look at the different interlinked socioeconomic environmental determinants of health, who are the actors that are involved? Do they have and are they capacitated with the agency to act? And is there accountability for health across those actors? So one of the things that we see, for example, in the health sector, when we talk about food and health, is that we're often surveilling disease, and there's very little still integrated surveillance, integrating the disease outcomes with these upstream determinants. Because if we don't do that, it makes it much more challenging to understand the health impacts of changes in those environments, or indeed, or of interventions upstream in the food environment to an impact on health. We've done some work. This is not food, but it illustrates it. We've done some work looking at integrating health in human settlements and built environments, sectors, using existing routine administrative data. And some of the lessons from that, this is in South Africa, and some of the lessons from that are that, yes, whilst suboptimal, those data do exist, but because they're not set up to be integrated. There are issues of interoperability. They're not always geo-coded, and so understanding the spatial dimension of health determinants is sometimes a challenge. So integrated governance, I think, is a critical part of the next normal when thinking about addressing healthy food environments. The third of 4 is that the next normal requires that we learn lessons from the last normal. And by last, I don't mean pre-2020, I mean the last time we thought something innovative was normal. And this is something on the right that I wrote recently, just reflecting on anyone who's trained in public health in South Africa is told about the Palelo experiment. I don't know if it's the same in the US, about how in the 40s in South Africa, in rural South Africa, there was this experiment of integrating community healthcare systems into the really embedded into the community. So rather than just waiting for people to present to the clinics, actually integrating an understanding of not just the disease states of households and communities, but what their vulnerabilities were. So in the context of rural and subsistence, understanding whether their crops had failed, understanding whether the anyone had recently lost a job, understanding whether what the growth trajectory of children in the household are, and really picking up the early warning signs of, because if you're subsistence farming and your crop has failed, that's an early warning sign that malnutrition is to come. So how do you anticipate that, and as a way of preventing ill health? So really learning from those lessons of the past to rethink urban health, because we've somehow broken that integrated that systems approach into more disease states. And building on that, the last point I wanted to make is that the next normal must be inclusive and equity focused. So if the previous slide was a Palelo 1.0, we wrote recently about what a Palelo 2.0 would look like. So bringing it in all the lessons of the realities of urbanization, the future-proofing in the context of climate realities, to say, well, could we think about what an integrated community-oriented primary health and climate care could look like? You know, what would that look like? How could we integrate climate resilience with primordial or primary prevention of disease, as well as delivery of healthcare? What is the role of, how can we rethink what responsive healthcare delivery could look like in ways that could actually address some of the dissonance and the disconnect between healthcare and health creation. The context of inequalities is so critical. So both within cities and within countries, in this pandemic, we've seen in the UK, UNICEF fed children in the UK for the first time in its 70-year history. That is a high-income country. Such are the levels of, in some parts of the country, we have 1 in 5 children experiencing hunger and food poverty. So when we talk about any metrics, let's make sure we're looking at within country inequalities, because if we're going to be inclusive and equity focused, we need those data to get us that, to tailor interventions accordingly. And the same goes with intra-urban inequalities. It also requires that we leverage community expertise and experience. So we've seen, for example, there are examples of rotating savings and credits associations. I thought it was an African thing, but I've recently discovered it's a global phenomenon of community-led, largely female-headed schemes to gain control over household expenditure and to protect household food security through leveraging social capital. These things tend to occur outside of the more conventional research and interventions, but actually there's all of this community expertise that's been building. So how can we learn from that experience to inform solutions that both protect health and do so in resilient ways? And relatedly, considering the role of these community actors. I mentioned a little bit about that, really understanding and connecting home and neighborhood environments to health data, to really understand how changes in food sources, how changes in access to water and sanitation, and household assets impact on food security. There was a recent study that by my colleagues have been conducting as part of the Global Diet and Activity Research Network, the lead in Kenya, where we looked at understanding, well, in what ways does the changing food landscape of the introduction of a new supermarket in a shiny new mall change the food sources and change the access to healthy foods, fruit and vegetables, particularly in the context where those are often sold on the street side. So really the unintended consequences of progress is really critical. I feel like, and the last point I wanted to make, really drawing from some of the talks of the previous presenters, is really remembering and considering the connectedness of global food systems. So we talk about what is happening in different cities, different towns, and different countries globally, but we also know that there are certain, in the context of huge discrepancies in power and privilege globally, there are also pressures placed on countries and cities where that are more that have less power in terms of global trade, in terms of really the subversion of country efforts to protect healthy food security by global trade and global corporations. So we see that, for example, in the context of South Africa and the sugar sweetened beverage tax and the interference from global institutions. We've seen that, not food related, we've seen that in the context of alcohol control even, and subversion by regional European Union and political power. So I think it's really important that if we're advocating for healthy food security anywhere, we have to be asking, well, what are our countries doing in terms of ensuring we're protecting healthy food systems everywhere? So I think I will end there. Oh no, okay, this is my last slide. This was an example of what future-proofed health and all urban policies could look like. This is not specific to food, but it's very relevant. So, because we're talking about the next normal and inclusive health. This was a webinar that was conducted by the African Development Bank's African Development Institute think tank to look at, well, what could post-COVID health systems in Africa look like? And these were some of the things that I'm biased teased out from that matrix of policy options that came out of it. And you can start to see ways of, when we're thinking about the next normal, this is the potential framing of the next normal. And you can see a lot of it is around the integrated governance mechanisms and integrated roles. Imagine if every minister had a planetary health portfolio where they had to show how they protected healthy food access. Imagine how if youth could be better leveraged to both be advocates and activists, but also citizen scientists to really measure and have put a pulse on the dynamic changes in their food environments and their lived environments in the short, medium, and long term. So for me, this is one of, I thought it good to end on, because thinking about what the next normal could look like, I think the pandemic and the radical responses that we've had to create as a response to the pandemic has really, hopefully, set aside our blinkered perceptions of impossibilities to really imagine a next normal that is healthy for all. So thank you very much.
Thanks so much, Dr. Oni. And I'm going to turn it over to Dr. May and just remind everyone that you can send questions in through the chat. So not through the chat, through the Zoom Q&A function on the Zoom meeting.
Okay, thank you so much, Julia. Can everyone hear me? I'm not on mute. Okay, just want to make sure. And thank you, Dean Galea, for inviting me, and Meredith and Alicia as well. This is just such an honor to be in this space. As I was listening to all of the speakers, it occurred to me that we are definitely in a new normal. Just the fact that we're even having this conversation with people in different time zones. And the other new normal, I think, based on all of my years of experience doing research in the public health nutrition space, is that we actually have speakers, from, I would say, siloed fields for many years. We talk about the food system being very complex. The truth is, many of our researchers work in their own silos. The people doing agriculture and the agriculture group, they have their own conferences. Someone like me doing nutrition, and Dr. Ramakrishnan, we go to certain conferences. And what's so unique about this, what's happening right now, is that we are actually literally collaborating and communicating. And it was just a delight, actually, to hear all of these presentations. So I do want to thank all of my colleagues. What I'm going to try to do is maybe take us to try to wrap around some of these ideas, and hopefully we can kind of have a conversation about what the next steps are. So I actually want to ask the question, is healthy food access a right or privilege? I'm not going to try to answer it right now. I think it's something that we all need to be thinking about, but I do want to take everyone just through this definition of food insecurity. And it's evolved over time, over the past few decades. I think for a long time, people thought of food security as just, not addressing hunger. And I think, in more recent years, we've kind of evolved that definition to kind of include the concept that it's about having everyone having access to healthy food in safe and socially acceptable ways. And I want to say sustainable ways as well. And I'm going to take us quickly to where we are today in terms of food insecurity, because in the United States, we have, food policies, we have food assistance programs that are considered safety net programs, the largest of which is SNAP, what most people used to know as a food stamp program, and that goes back many decades. SNAP stands for Supplemental Nutrition Assistance Program. And I just want to look at the food insecurity rates here. And what we have here is in 2019, you see it's 10.5% for food insecurity, 4.1% for very low food insecurity. That's an indicator that the U.S. Department of Agriculture has developed. And then when we look at food insecurity in 2020, we actually see a drop from 4.1 to 3.9%. It wasn't the increase that everybody thought would happen. So really, what happened during the past year? So this is data that is from the Census Bureau's Household Pulse survey. And that survey was launched in April of 2020 to try to kind of assess the impact of the pandemic on people's lives. And they asked simply one question, and it was whether people had sufficient food to eat, essentially. So not that rigorous of a measure as the USDA's food insecurity measure, but nevertheless, it gives us a really good indication of what's going on. And we can see that in January, when the stimulus check payments were dispersed, we started seeing a drop. And then later on in April, when the second round of stimulus check payments came about as a result of the American Rescue Plan, we saw another dip. And now, we're trying to see what's happening right now as food policy changes. So what then really, happened? I think the charitable food system definitely kicked in. I'm trying to remember the numbers right now, but Michael Flood, from director of LA Regional Food Bank, was talking about a huge increase of over 35 million pounds of food being given away, 145% increase from the beginning of the pandemic to March of this year. I mean, that's a huge increase. And then, of course, the stimulus payments, some of these policies that came about because of the pandemic. But I want to focus on the food policy provisions that came about as a result of the CARES Act and the Families First Coronavirus Response Act, of FCRA, and also the American Rescue Plan. What happened was, these pieces of legislation allowed for waivers and exemptions for the SNAP program, for the WIC program, etc. And the whole idea of this, that it would make it easier for people to enroll in these programs during the pandemic. But I want to say these waivers and exemptions, these are all suggestions and recommendations that have been made by researchers and others who have studied this for decades. It wasn't new. We knew what the problems were. We knew that there were a lot of administrative challenges and barriers to people enrolling. We knew that immigrant, non-English speaking populations were having a really hard time enrolling in it, not really understanding how to do it. And we also knew that the benefits that were given by SNAP were not enough. They never kind of went up with cost of living, with increase in food prices, with increases in rent, etc. And it took the pandemic and political changes to kind of get us to this point right now, where we're recognizing that these safety net programs do make a difference in terms of food security. And so I think people are somewhat excited that after decades of us asking for these changes, the Thrifty Food Plan, which is the basket of foods that determines how much SNAP benefits people get, got revised recently, recognizing the increase in food prices, cost of living, etc. And so this is kind of what you're seeing here is a graphic representation of this increase in SNAP benefits during the pandemic with this Thrifty Food Plan reevaluation, these changes that just literally took place and kicked in October 1st, and what might happen if some of these provisions that came about because of the pandemic were to go away. And I think this is what we are all wanting to see, what's going to happen in the coming months, actually. And so we are at this time when we realize that food policy does have an impact on food insecurity. There's much research that shows that. We know how important it is. Dr. Ramakrishna talked a lot about, hunger, food insecurity, nutrition, and its impact on chronic disease risk, on growth and development of children. And we know that, vulnerable populations, those who have been food insecure before, who are unemployed, we know racial racism and racial disparities. And a lot of these factors we know are associated with food insecurity. And we saw this play out during the pandemic. I think one more thing I want to mention is that this whole problem of food insecurity is pervasive. It's been affecting college campuses as well. And prior to the pandemic, University of California, where I am, we did a study. We found more than 30% of our students were food insecure. And I remember very clearly when we presented the report, people were kind of shocked, and many people would say, how can this be? These are UCLA students. And now we're seeing, it's pervasive through a lot of universities, public and private as well. So the question I ask is, what should be our response, right? Universities are stepping in. UCLA is seen as a model because of our students who are activists. They got the SNAP program to come onto campus. So now we actually have a SNAP initiative called the UCLA CalFresh Initiative on the UCLA campus. Other universities are following suit, but is that the long-term solution? And there are equity issues involved. I've talked to students, and while they're getting help with enrolling in CalFresh, should university students be coming in having to deal with these issues? And I think if we think about college education being a way out of poverty, right, then should we not be providing the basic needs, food and housing, to allow students to be successful, to allow students, to allow families to move up the social mobility ladder? And so this brings us to this, I think, really urgent question: is healthy food access a right or a privilege? And I think, you know, this is just such an important topic, because it's while in many developing countries, we worry about both undernutrition and overnutrition, as Dr. Ramakrishnan was alluding to. In developed countries like in the US, we may not be as concerned about the underweight, right? We're concerned about obesity, etc. And one of the reasons we know is that we are surrounded by food environments where healthy food is not readily accessible. And we saw that through Dr. Nguyen's presentation, to Dr. Oli's presentation as well. And so Dr. Nguyen talked about the need to restructure structural, how did you put it? Eli did it really well, to restructure structural systems. I thought that was a very nice statement. And so I think what we've come, and then where we are at today, I think, is in a way maybe depressing, you know, in terms of the outcomes, but at the same time, I think it's also a wonderful opportunity for us to start collaborating a lot more closely across sectors, across disciplines, because we know that healthy food excess is part of this food system that is so incredibly complex. And Dr. Ramakrishnan had talked about the Eat Lancet Commission and about studies, wondering is it realistic to implement this in developing countries, or at least it's kind of expensive. At the same time, I think what was in the Eat Lancet Commission that was maybe revolutionary in some ways is that it helped us tie the health aspects to the planetary and environmental aspects, and to help us make that link to climate change and how environmental sustainability in the end affects food security, and the populations that are most affected are those who are vulnerable. And so I quickly put this slide in. I was actually in a meeting right before this meeting as a kickoff meeting for the Food Equity Roundtable that LA the County of Los Angeles just established. And just really quick thoughts from my impressions of the meeting I was at. I was really inspired by how they managed to bring key stakeholders from many different parts, representing different parts of the food system. So there is hope, and I see hope in this group too. And I just want to thank everyone for being part of this space. So I'll pass this back to Julia.
Thanks so much, Dr. Wang. That was really wonderful. And all the presentations were. So we only have a few minutes left. So I will try to maybe just ask a question and then see where we get. You all did such a great job of outlining how this virus exposed vulnerabilities in our society, including these glaring deficiencies in the food system. And you've also pointed to the importance of addressing the upstream drivers of nutrition problems like racism, poverty, the built environment, how we need to include people of every age in solutions. And we also need to consider planetary health and the environment. So this sounds like a very tall order. And we only have a couple minutes left, but maybe in a few words, if you were food health czar for the day, how do we even begin to address this? Where do we start? Maybe we start, who should we start with? Maybe Dr. Ramakrishnan.
Sure. I think as someone who works in public health, we always look at the glass half full and not half empty. And as dire as the pandemic has been in terms of the lives that should not have been lost, I think there are a lot of lessons. I took over as chair of a department from one of the top infectious disease people who knows a lot about the pandemic. But being in a department of global health, we work across sectors. So there are a lot of lessons that we can learn from how the pandemic affected the world at large. It was an infectious agent, but many of the structural issues, the weaknesses in health systems, the role of different stakeholders, I think that those things are very relevant to sort of the mundane business of eating healthy. And that's, I think, where we should move forward as thinking, systems approach, and identifying sort of the role that everybody can play. Because I really like Dr. Wang's final slide. We don't want to be a cacophony. We want to be an orchestra. We want to be a symphony, and that requires reaching out. Everyone can't be an expert at everything, but we bring in our expertise and keep the common goal of health for all. I mean, it sounds really redundant, right? I mean, that was what Alma Ata said in 1978 when we talked about primary health care. And I've been thinking about when Dr. Oni talked about the Fulele 2.0, we almost need an Alma Ata 2.0 as we think.
We're about to run out of time, so I want to turn it back over to Dr. Guria, but I was just wondering if any other panelists have a couple of quick words they wanted to say, or should we wrap it up?
If I could add something really quickly, Julia, it just occurred to me. I was in an NIH workshop, and there was a basic scientist there, doing molecular work, and it was heartening to hear her say, "We need to translate our research more quickly. To do that, we need to engage the community, and we need to listen to the community." And it was really heartening to hear that.
That's a great point. Thank you so much for these fantastic presentations. And I think
can I just build on that very quickly, just to say that picking up on President Wang's point of people, is that I do think we need to go back to food as a space of joy, right? So fundamentally, there is a joy in food that has been hijacked for joy to be unhealthy and processed, and we need to, if we tap into that joy that you get from actually eating well, I feel that there's a lot of untapped power there, and then looking at how we make that actually a choice for the majority of people by tackling the structural determinants. But I feel like at the core of it must be the joy that comes from food, and the togetherness that comes from food.
That's a great point, and I'm all for that as well. Thank you so much, and I'll pass it back over to Dr. Guria.
Well, I'm not sure that I know how to say anything better than making food a space for joy. I actually think that's a wonderful benediction to such an interesting conversation. I think there is no greater compliment to a panel like this than to say that I actually wish it went on for another hour or two. I was so enjoying listening to all of you, and I know there would be many more questions if we had time, but I want to say thank you. Thank you for the work you do every day. Thank you for sharing some of the work with us, and thank you for helping us think through these issues. Julia, thank you for excellent moderation, and to our audience for being a part of these conversations as we all, as a world, struggle with how we shape the next normal.